Hello, my name is Kelly Heron. I'm a registered nurse and I'm the clinical coordinator here at 3 East.
And I'm Matt Griffin. I'm our Chief Medical Officer here at Huron Valley Sinai Hospital. Today we want to walk our physicians through the use of our rapid rounding board. We're on 3 East, and Kelly and I today are going to go through an example of how we would utilize this board for your patients.
We're going to go through one patient, and room 10 is over here. This tells us our nurse and our PCA, our doctor, and our admission date, our discharge planning for Medi Lodge. Here is a question for the doctor.
So in these cases, the patient or one of the care team can provide a question to me. Obviously, I can then address that either with that team member or with the family once I have my answers to that question.
Okay.
At this point in this case, we had looked already, and we were going to get a pulmonary consult on this patient as well as an oncology consult. We know that there are some studies that are pending in this case, and the plan of care for today are to get these studies done, particularly the chest x-ray and the studies regarding congestive heart failure. Our guess on this patient for their geometric length of stay is not determined yet because we don't have a final diagnosis. But as a physician, I am going to guess that this patient is going to be safe to go tomorrow based on what we have so far. I want to explain these dials because these are our visual signals to the team to help move things through quickly. We have red, yellow, and green when we're looking at the patient's status. The red patients are more than 2 days away from being discharged, most likely a very early admission. The yellow means that the patient is 1 day away from being discharged. And then green indicates that the patient is going to be discharged today. In this column, we have a similar signal where our case management team is able to signal whether they have yet seen the patient, if so, are they in progress, or when they have completed the care that they need to provide with that patient. And our final tab is our discharge order tab. And this badge is going to show if the patient actually has a valid discharge order in place. That's how we would go through for a single patient. Obviously, there may be more questions or other entities that need to be addressed during this time, but it's meant to be very quick. It's meant to be very easily exchanging of information. So we hope that you'll partake in this and use it to your benefit.